Hey there and welcome. If you're a medical professional getting ready for the OET speaking test, you already know that clear communication is absolutely everything. So in this explainer, we're going to break down the exact grammar you need, step by step, so you can have confident conversations with your patients and, of course, ace that test. Let's get right into it.
Okay, first things first, we have to lay the foundation. Before we dive into all the specific formulas and verb tenses, it's really important to understand why getting this grammar right isn't just about passing an exam. It's actually at the very heart of good patient care.
Think about it like this. Your score is built on four main pillars: clarity, flow, style, and accuracy. Now look at that fourth one, accuracy. That's where grammar lives. It's all about using the right tenses and putting your sentences together correctly. And in a hospital or clinic, accuracy isn't just a nice to have, it's about patient safety. A tiny grammar mistake can cause a huge misunderstanding. So really, grammar is the foundation holding everything else up. Without it, your clarity crumbles, your flow gets choppy, and your professional style just falls apart.
All right, let's get to what I think is the most critical part of any consultation: gathering information. We're going to zoom in on how to build the perfect questions so you can understand your patient's story clearly and super effectively.
I want you to think of building a question just like playing with Lego blocks. It's a simple formula you can use over and over again. To make what we call an open question, that's a question that gives your patient lots of room to talk, you just need these three blocks. First block, a question word, like what or how. Second block, a helper verb, like brings or can. And the third block, the subject and main verb, like you today or I help you. Just snap them together and you get what brings you here today. See? A perfect open question.
Okay, so you've got the basic structure down, but now we need to talk about what is, without a doubt, the single most important grammar rule you have to master, and that is choosing the correct verb tense. This is what makes the difference between asking about a problem that's happening right now versus one that's already over.
And this visual shows that difference perfectly. Take a look at the left. For a problem that started in the past but is still going on, we use the present perfect. See how that timeline arrow goes right through the present moment? Now look at the right. For an event that is totally finished, we use the past simple. It's just a single dot in the past. Getting this difference right is absolutely essential.
So this brings us to what I call the golden rule of time. If you remember just one thing, make it this. To ask about duration, a problem that's continuing, you use how long with have. For example, how long have you been feeling sick? But to ask about a specific, finished point in time, you use when with did. For example, when did you vomit? That one little word choice, have or did, completely changes the entire meaning of your question.
Now let's put this into a strategy. Great communication isn't just about asking random questions. It actually follows a pattern. Think of it like a funnel. You start wide at the top with a big, open question like, can you describe the pain for me? Then you start to narrow it down with a more focused question like, where exactly does it hurt? And finally, at the very bottom, you use a closed, yes or no question to confirm the details, like, does lying down make it better?
And when you get to that final yes or no question, there's one more little trick to sound super professional. It's not just what you say, but how you say it. For a closed question, your voice needs to go up at the end of the sentence. This is called rising intonation. Just listen to the difference. Any pain in your muscles? Hear that? That little lift at the end signals to the patient that you're expecting a yes or a no. It's a small detail, but it makes a huge difference in clarity.
So, you've asked your questions, you've gathered all the information, now the tables turn. It's your turn to give instructions back to the patient, and you've got to do it with that same confidence and clarity. The key here is professionalism. You never want to use a raw command like, stand up. Instead, you use these simple, polite formulas. For a request, try, could you, as in, could you please bend down for me? For a gentle but clear instruction, use, I would like you to. And to explain what you're about to do, you can say, I am just going to test your reflexes now. These phrases are always clear, professional, and respectful.
Giving clear information is one thing, but making sure the patient actually understands you, that's everything. And this slide is so important. It's your job to translate complex medical jargon into simple, everyday language. So instead of saying hypertension, you say high blood pressure. Instead of dyspnea, you say shortness of breath. When you do this, you build trust and you make sure your patient is truly on the same page.
So what do you do when you have a lot of information to share? You don't want to just dump it all on the patient at once, right? Well, there's a great technique called signposting. All it means is using simple transition words like first, secondly, and finally. This breaks down your advice into smaller, bite-sized pieces, making it so much easier for the patient to follow along and remember what you said.
Okay, we have covered so much ground here, from question structures and tenses all the way to giving clear instructions. So now, let's pull it all together into one simple, memorable formula that you can take away with you.
And here it is. This is your winning formula. It's built from 3 simple parts. First, perfect grammar. That's using the right tenses and the question funnel. Second, a clear structure, using that signposting we just talked about to organize your thoughts. And third, simple words, translating any jargon into language anyone can understand. When you combine these 3 things, the result is always the same, a comfortable, informed patient. And that right there is the key to success, not just on the exam, but in your daily practice. So as we wrap up, I'll leave you with this question. Thinking back on everything we've covered, what's the very first formula you're going to practice today? Whether it's the golden rule of time or those phrases for polite instructions, the real key is to start practicing right away. Thanks so much for watching.